Dr. Marcel Morel, who is the president of the Joint ILAC-CESI Board. CESI is a Dominican nonprofit that focuses on healthcare, whereas ILAC focuses on education. Dr. Morel is a radiologist and has a very successful radiology center in Santiago, and also started a large general medical clinic in the poorest part of Santiago, a city of 1 million people, where they serve the poor. Dr. Morel and I first met when we collaborated on hernia mission, and I had founded a nonprofit that supports and organizes hernia surgery teams, and we use the ILAC-CESI Surgical Center, which is a beautiful facility. After 5 years, Dr. Morel and I had a brief conversation during which she planted the seed for CCI. He told me that 75% of the admissions to the large charity hospital in Santiago, 75% were due to the complications of diabetes and hypertension. An amazing number. After about and that started our project, and it was termed a pilot project, started the program. After about 4 years of acceptable pilot project patient care results, we formalized the CCI-CESI collaboration with a carefully worded agreement with Dr. Morel as the joint board chair, signing it eventually after being scrutinizing the agreement very carefully because it was necessary. ILAC and CESI, by the way, have the best reputation in the Dominican Republic as a healthcare related nonprofit, so it made sense that he would be careful. We were greatly benefited by this because it gave us momentum. We started to be able to treat more patients, and it gave us credibility because of the reputation that ILAC and CESI has. And now, Dr. Morel is able to help us with something even more significant. That's sustainability. It is a key question. And because of Dr. Morel's reputation and ILAC-CESI's reputation, they have been able to have and will be having more substantive discussions with the Ministry of Health concerning insurance payments for diabetes and hypertension care nationwide. Those payments, although small in amount, will sustain the CCI program because the program costs are so low. Dr. Morel planted the seed, nurtured the program, and is the pivotal person to help make the model of care spread countrywide. He absolutely deserves this award. So I ask you to please welcome Dr. Marcel Morel from the Dominican Republic.
Well, good morning and thank you all very much. This is quite the honor. 10 years ago, we were in the middle of a massive surgical mission in the Dominican Republic when Dr. Philippi approached me and said softly, he always did that, Dr. Morel, I have something I want to talk about it and I believe we should consider. I don't know if you all know Dr. Philippi well, but let me tell you that I for one was sure that whatever was in his mind has been carefully thought through, planned, and full of commitment. I was more than happy to sit down, fasten my seatbelt, and listen. The proposal was a comprehensive project for detection, education, treatment, and follow-up for diabetes. This program, the brainchild of Dr. Philippi, his wonderful daughter-in-law, Linda, and wife, Mrs. Philippi, was born out of the necessities they saw while operating in our country. After several meetings discussing where and how to implement it, we approved a small pilot plan in the community of Comedero in the middle of the island, which soon proved its value. Through education and involving people in their own preventive care, the program changed the life of about 1,000 families. Thus, CCI ILAC program was born. During these last 10 years, it has grown to be the paradigm of diabetes and hypertension care in our country, and really a model to follow in Latin America, largely due to the leadership of Dr. Hans Dethler, our medical director. It has been published by scientific journals, consulted and referred by international public health specialists. The CCI program has truly pioneered preventive care and positively impacted the life of thousands of families in underserved communities in the Dominican Republic. For those that do not know much about ILAC, please let me share a little bit of our history. Mission ILAC is a non-profit institution that develops and promotes the human and spiritual growth of rural communities of Dominican Republic based on ideas of love and service. It was founded by Father Ernesto Travieso and Narciso Sanchez, two Cuban Jesuit missionaries from Omaha, here, in 1973, when they began doing summer medical programs with health sciences volunteers from Creighton University, led by Dr. Joe Lynch. ILAC's mission is to integrally improve the lives of people in underserved rural communities by first reducing the excessive immigration of farmers to our cities, where less favorable conditions of the marginalized neighborhoods often do not contribute to their personal development, their living conditions, and their spiritual formation. Through education and implementation, the health programs we have managed to improve the lives, empower changing individuals, and contribute to the social, economic, and spiritual development within their own communities. The ILAC missions covers with its services the north and southern region of the island for an estimated population of about 250,000 individuals, and with 160 volunteers, health cooperators from the same communities. With multiple and international donations, we have been able to build a campus and an outpatient facility that houses 19 week-long surgical medical programs, which provide 20,000 consultations and more than 1,200 surgeries years after years. ILAC also runs training programs for our community leaders, support organic agriculture, health education and school development, the construction of aqueducts, rural clinics, and other community infrastructures. Our organization is currently managed by a volunteer international board of directors. We maintain affiliation agreements with several American universities and a very, very close relationship since our inception with Creighton University. Many of its students fly down to participate in our programs, to have the immersive opportunity to be hosted by families in these communities during their stay. The hypertension diabetes program is the only international resident program that we host throughout the year. It receives all the logistical support from our facilities and is one of the most valued by our collaborators and awaited by our communities, many that still do not have access to the proper health care. The miracle of care and health achieved by this program is truly invaluable. Continuing this work and being able to extend it to other communities is the goal that we have ahead of us. I appreciate the presence of all of you and the opportunity to tell you what your support and donation have made possible. Thank you. I believe that the recognition that I received today with and humbly share with all my ILAC collaborators should be indeed yours. It is because of your generosity we have been able to impact and provide a new life and hope to so many people. Have a good day.